I've had patients who got 6,000 grafts in one go from clinics chasing big numbers. But now, they can't do a second surgery, and their donor zone looks patchy.
Hair transplant facts or fiction? Today we're putting the top myths under the microscope with the help of an actual surgeon. Meet Dr. Ko, hair transplant surgeon in Seoul.
Hey everyone, let's bust some myths, and maybe save a few hairlines along the way.
Okay, first one, a lot of people think you need to be completely bald to even consider a transplant. Is that true?
Actually, the opposite is true. The best time to act is before you're bald. Most of my patients are in their 30s or 40s and still have a decent amount of hair, but it's thinning, especially at the temples or crown. If we wait too long, the donor area might not be enough to cover all the bald zones. But if we catch it early, we can blend new grafts with existing hair and create density where it matters, without it ever looking obvious. Think of it like reinforcing a house before the roof caves in. We're strengthening weak areas before they collapse.
Everyone's seen those pluggy results. Are we past that now?
Thankfully, yes. That dull hair look came from outdated techniques. They used to transplant thick clusters of hair that looked like toothbrush bristles. These days we use micrografts, just 1 to 3 hairs per unit, and place them according to natural hair direction. For the front hairline, I often place hundreds of single hair grafts in a zigzag feathered pattern. It's like painting with follicles. If done right, even your barber can tell you had surgery.
How soon until people notice my new luscious locks?
I wish it were overnight. But hair biology doesn't work like that. After surgery, most of the transplanted hair actually sheds in the first 3-4 weeks. That's completely normal. The follicles are alive, but the hairs are temporarily shocked. Then you enter a quiet phase. Around month 3 or 4, new hairs begin to sprout. By month 6, you see real improvement. By month 12, most people are thrilled. Some patients see continued thickening even into month 15. So, if you're planning a wedding next month, get a wig. But if you're playing the long game, this is the real deal.
Can't I just keep going until I get the density of a lion?
If only. The reality is, your donor area, usually the back and sides, is a limited resource. It's like a bank account. You can withdraw grafts, but if you take too much too fast, you'll run dry, and there's no hair donor ATM to refill it. I've had patients who got 6,000 grafts in one go from clinics chasing big numbers. But now, they can't do a second surgery, and their donor zone looks patchy. My job isn't to max out your graft count. It's to maximize your long-term result. Smart planning wins.
People say the new hair eventually falls out again. True?
No, and here's the science. The hair we transplant is taken from what we call the safe donor zone. These follicles are genetically resistant to DHT, the hormone that causes male pattern baldness. So even if your native hair keeps thinning, the transplanted follicles stay put for life. But the key is placement. If a clinic harvests from the wrong area, those hairs might fall out eventually. That's why experience matters.
Can I toss my pills once I've had surgery?
Only if you want to play hair loss roulette. Hair transplant fixes the past. Medication protects the future. If you skip it, you might lose the surrounding native hair, and that creates weird gaps around the transplanted zone. For many patients, I recommend a combo: finasteride to block DHT and minoxidil to stimulate growth. It's like watering and fertilizing your new garden. Otherwise, the weeds come back.
Myths busted. Hairlines protected. Dr. Ko, thank you for the scalp wisdom.
Always happy to educate. If you've been thinking about a transplant, ask, don't guess.